I've been a 68 Whiskey, the National Guard, for 4.5 years. When we first came onto mission, it was a little more rigid because we weren't sure of what we were encountering. We weren't sure of what was going on. We weren't sure of how the outcome would be. So for medical, it was kind of intense because we were trying to help everyone that we could, but then also soldiers were going down. So between helping soldiers and civilians, it was very intense.
In the beginning, Javits was a hospital, and at the time our main job was to patrol and make sure the patients were secured in their area and nobody else that wasn't authorized was walking around. It was very chaotic. We were first called and only had 3 days to pack everything up, and we honestly brought all our gear because we didn't know what to expect. Even when we first got to Javits Center last year, everything was changing every day.
I've been on the mission since March of 2020, since the beginning, more or less. We've been here at the Javits. We went from support mission medically, where we had the hospital based here, to support civilian counterparts for ICU and beds. And we went from that to more of a proactive approach, attack mode, you could say, fight COVID. So we went to vaccinations.
It is still a threat. It's not something that you sleep on, but it's something that we actually feel more comfortable dealing with when it comes to the symptoms, when it comes to the patients. It's something that's way easier for us to handle when it comes at us. But now we're here giving shots, so we're seeing the better end of it now that we're in the Javits now. People are getting shots, they're walking out, they're walking in and walking out, they're not being rolled in and out. Family members are happily coming in together. It's actually very rewarding to see that my efforts do help civilians and soldiers as a whole, because I gave vaccines, I drew vaccines, and it's just amazing to know that I did make a difference.
Being in the Guard specifically, I'm able to stay here. If I was active duty, I would not have been able to be stationed in my own city, nor would I have been able to be, just to help my neighborhood. Not that other neighborhoods aren't important and aren't deserving of help, but it's a little bit more special to be able to say I grew up in this city and I helped out here.
I can say this, the DMNA forces, the National Guard, and all the other support branches have done an excellent job in putting everything together and coming together cohesively and working together with our civilian counterparts. It's been amazing, the fight that everyone put forth, and it's an honor now to see everything descaling and knowing that we did a great job.